Hi, everyone, and welcome. My name is Kelly Hooper. I'm a healthcare reporter at Politico, and joining me for a conversation today is Dr. Bruce Scott, the president of the American Medical Association. Dr. Scott, I have to start out by asking you about a comment made by Callie Means during his panel here just a few hours ago. He said the Centers for Medicare and Medicaid Services is being controlled by the American Medical Association. So I wanted to hear your response to that.
Well, I guess I would say I wish. There's a few things we would change, many of which we're going to be chatting about. I want to thank you for the opportunity to be here and thank Politico for sponsoring. This is a great opportunity. It's interesting to me that we're talking about healthcare, and I think I'm the only physician who's actually practicing who's on the agenda today. And maybe that's part of the problem, that we need to get back to letting physicians actually be in control of our healthcare.
What do you think he meant by that CMS is being controlled by the AMA?
Oh, I think that it's a misunderstanding. I would say, also for the record, that the American Medical Association does not receive funding from the pharmaceutical industry. In fact, we have disavowed funding from the pharmaceutical industry for many, many years. I think the important thing is that there are some things we agree about, and I think that's what we need to work with the administration on. To be clear, we need to address chronic disease. We need to address nutritional issues. We all want children to be healthy. We want adults to be healthy. We want our parents to be healthy. And I think that what we are looking for is to work with the administration, including Kennedy, about the different things that we can do to improve health care in America.
Do you think there's merit to the argument that there needs to be more of a focus on the prevention of disease rather than treating sickness as the standard of care, as Means and Secretary Kennedy and others have suggested?
I think that there does need to be an emphasis on prevention. I think we've already seen some of the stuff from the Affordable Care Act has started to cover preventive care, and I think that's really important. And I think that there's already an emphasis on that. That said, I'm a surgeon. And so one of the things that we have to do is take care of the acute problems that exist right now. So we can't have a slash and burn technique. We need to focus on the current problems, but at the same time, we do need to emphasize preventive care. And some of the things that the American Medical Association has been pushing for years does emphasize preventive care.
Something that HHS Secretary Kennedy has expressed some interest in is Medicare payment reform, including targeting the AMA's role in setting relative value units, which is a metric that can help determine how much Medicare pays for certain services. Does that concern you at all? And could you talk about what that would mean for the AMA if the organization had less of a role in the decision-making process around doctor payments?
The big thing that concerns the American Medical Association, and frankly physicians all across America, is the 33% pay cut that Medicare has forced upon physicians over the last 24 years. Believe it or not, physicians are paid 33% less for the same services that we were providing in 2001. Imagine those of you who have companies here, if you were being asked to provide the same services 24 years later with the inflation that we've all lived with 33% less revenue coming into your company to my practice. And as a result, physicians are struggling. As I travel around the United States, I talk to physicians and I hear the stories. I hear the stories of them reducing the number of Medicare patients they're able to see, stopping taking new Medicare patients, reducing their staff, not investing in new technology, and sadly, in a lot of areas, closing their practice altogether. And particularly, I'm from Kentucky, a rural state, and in Kentucky and other rural states and where there's underserved population, when a physician closes their doors, the access to care for those patients is just terribly harmed. In some cases, 100-mile-plus drive to find a physician, if you can even find a physician who's taking new patients. And the frustrating thing is these are our most vulnerable patients, our senior citizens, our people who have permanent disability, the people who are less able, in many cases, to find a new doctor and to get new access. So that's what we're really focused on and really concerned about, and we're looking for a rollback. But believe it or not, we're up here in Washington spreading that message in 2024, and yet we got another cut, another 2.8% cut starting January 1st, 2025, despite the fact that CMS, which we don't control, predicted that our cost of providing care would actually go up 3.5%. So if you think about it, it's unsustainable. It can't have continued cost with lowered what they're paying us to our practices just to keep up with the cost of providing the care. At the end, physicians are struggling, and I really fear for access to care for our senior citizens.
Speaking to the funding cut, so a funding bill passed the House earlier this month or earlier last month that will allow a 2.8% cut in funding to physician payments. You've been vocal about these cuts, as you were just speaking about, and about how they will affect private doctor practices. How do you think the payment formula can be improved upon?
Well, pretty simply, the payment formula for physicians needs to be linked to the cost of providing care. Now, here's the really crazy thing. Hospitals, ambulatory surgery centers, long-term care facilities, basically everybody else in Medicare already gets an inflation-based update, but not physicians. How does that make any sense? Physicians are the foundation of health care, and yet we don't get the update. And I guess the thing that I would say to our legislators is every time there's an election, we hear our legislators say, I'm going to protect Medicare. I'm not going to let Medicare get cut. But yet they continue to allow the payment to the physicians to get cut. If there are no physicians to provide care, how is there Medicare? It just doesn't make any sense.
Republican Congressman Greg Murphy has said that he received assurances that Republican leaders would consider stopping the doctor pay cut in the budget reconciliation bill. How confident are you in those assurances, and are you hopeful that there's still a chance to avert the cut sometime this year?
I'm hopeful that there's still a chance. I'm nervous about the prospects because we heard similar things December the 15th. I was here on the Hill, and we had bipartisan support for a specific piece of legislation that would roll back the 2.83% cut and actually begin to link the cost of care to the payment. And that was left on the cutting room floor. Then we were told during the continuing resolution discussion that we were in there, and really appreciate Representative Murphy, his work, and the others in the Doc Caucus who all really were champions on this issue. And we thought we were going to get a fix. And then it got cut again. And I think a lot of the reason for it getting cut was not because there's not bipartisan agreement, because I think there really is, but because of a desire to keep the packages skinny, if you will. And I think that now it's time for us to push forward with what is right, that physicians in America who are struggling to take care of the Medicare patients basically need a cost of living increase, which they haven't gotten in 24 years.
Do you think there will be, appetite among Republicans to address the issue, just given how costly it is, and, especially that they might not want to add more costs to the reconciliation bill, and sort of where does that leave you on the issue?
Well, we do have, as I said, bipartisan support. We have Republicans on that side who are very much champions for us. We have Democrats as well. This really is bipartisan. I think that's what makes it hopeful for me. I recognize that there's a cost. There's a line item cost of passing this legislation. But I guess what I would answer back is, what's the cost of not fixing this? We have a projected shortage of 86,000 physicians in 10 years. We already have a shortage of physicians. There are hundreds of counties in the United States that have no obstetrician, no primary care doctor, where the nearest physician in a specialty is 100+ miles away. It takes 8 to 10 years to train a new physician. And so if we don't address this problem today, we're not going to be in good position in 8 to 10 years from now when we're facing that shortage to address the problem at that time. So I'm hopeful that they'll see the light. It's interesting that every person in the House and in the Senate who has a medical background supports this legislation. So CMS supports this. The Medicare trustees support this. MedPAC now supports this. It's time for the rest of the legislators to listen to people who are knowledgeable about the system and recognize that change needs to occur.
If Congress is to act, it would most likely be a short-term fix. So what do you think longer term, what needs to change to address some of the structural issues with doctor pay?
Well, we need to roll back this 2.83% cut right now. That was in the legislation both for the continuing resolution and at the end of the year. But then we need this longer-term fix. Physicians need to know that there is a sustainability, that medical students need to know that there is a future. There was a study done of second-year medical students that 40% of them said they probably never intended to practice clinical practice because of the challenges that they're seeing within medicine. Now imagine that, a shortage of physicians, and yet almost 50% of medical students are saying, whoa, wait a second. That's why we need this long-term fix. And that's what we're really pushing for. This isn't some radical idea. It basically puts physicians on par with all the rest of the providers, from the hospitals to long-term care facilities to everyone else who takes Medicare. It makes sense to put the physicians on that same platform of giving us something for the future that we know we can look to and say it will be sustainable and I'll be able to keep my practice alive.
Just switching gears a little bit, I wanted to ask you about the sweeping cuts that GOP lawmakers are considering to Medicaid, potentially putting health coverage for millions of people at risk. We've seen hospitals, provider groups, insurers, advocacy groups speak out against these cuts and push Congress to protect Medicaid. What is the AMA's stance on the cuts that Congress is considering?
The AMA is very concerned about the degree of the cuts. Let's be clear, we're okay with reductions of fraud and abuse and those sort of waste, but we have serious concerns about the degree of cuts that are being talked about. The understanding is very clear. We know that people who do not have health care coverage live sicker and die earlier. And that's wrong. In a country with the resources that we have, we need to make sure that, and if you examine the actual cost over the long term, it is so much better to get people care when they need it in a primary care doctor's office, in the regular physician's office, rather than what they reach out to, emergency rooms, urgent care facilities. They go into the doctor once they're desperate, once the cancer is no longer a stage 1, easily and relatively inexpensively treating. Instead, they go when they're in a disaster, when it's a stage 4 cancer. I see this in head and neck throat cancer. I see this in patients who don't have the resources, who don't believe that they can get the care. They delay care, and that delay of care ultimately costs more money. So we're deeply concerned.
In 2017, the AMA was very vocally against Republicans' attempt to repeal the ACA. And the group was specifically opposed to caps on federal Medicaid spending, which is being floated by some Republicans in Congress now. Can we expect to see a similar push against those proposals from the AMA this time around?
Well, we haven't seen a specific proposal, but the proposals that are being chatted about, again, we have deep concerns about a number of those. We think that the expansion of Medicaid in the states that have chosen to expand it has proven to be a very good thing for our health. So anything that would roll it back would be of concern.
And I think we have time for maybe one more question on a totally different topic, but one that seems to be top of mind for doctors, which is the increasing use of artificial intelligence in healthcare. Where do you see room for improvement in the federal regulation of AI in healthcare, and what do you want to see more of from the federal government on this topic? You know,
physicians are excited about the potential AI. We like to call AI augmented intelligence rather than artificial, in order to emphasize the role of the physician. AI will never replace your physician. That is not going to happen. We need that human touch, the human feeling, which is so much a part of healthcare. And yes, regulation needs to be put in. I will tell you that in a survey the AMA did, physicians are equally excited and equally terrified about AI. And one of the things that we've seen early happen is insurance companies utilizing AI to deny more and more care. So that's not the reform we're looking for prior authorization, not the ability to more rapidly deny and delay needed care. That's one example of where AI has turned sinister. On the other hand, physicians right now spend about 2 hours on administrative care for every 1 hour of taking care of patients. And if we could reduce that burden of administrative care, documentation, and some of the other things that we need to do by use of AI, then it's wonderful and physicians will embrace that.
What's the right vehicle to get that done?
Oh, I think that there's so much investigation and innovation happening out there. We just need to make sure that we keep our eye on the ball, that the goal in everything is to take care of the patient, that the patient needs to remain the center focus of our care.
I think that's all we have time for today. Thank you so much, Dr. Scott, for speaking with us. We really appreciate your time. And next up, we have Senator Maggie Hassan, who will be speaking with Politico's Erin Shoemaker.